The issue of plastic surgery not only affects Hollywood celebrities, but it affects everyday individuals as well. Some of the most beautiful people that you see on big screens, well, they've had plastic surgery. And everybody's out there trying to search for the perfect look. Our guest in studio is a board-certified plastic surgeon. He's been serving the Hispanic community for over 14 years with his own clinic in Washington Heights. And he's here to tell us what precautions you can take when considering plastic surgery and what you should exactly know. And we welcome Dr. Jeffrey Yager of Yager Esthetics. And we welcome you, Dr. Yager.
Thanks so much for having me.
Glad to have you. Listen, when we talk about plastic surgery, I think a lot of people become very familiar with the whole Hollywood celebrities, as we said in the intro. And it seems to be gaining more and more popularity. And while it is popular, yet and still, you have to be cautious about the whole plastic surgery and the whole process in itself. Talk to us a little bit about some of the things that we take for granted, that we see in Hollywood, but we should know in our everyday lives.
Sure. I mean, first and foremost, plastic surgery is surgery. And the key word is surgery, meaning that there are risks, that you need to do your homework before you select your provider for plastic surgery. With the explosion in popularity of plastic surgery, there's a lot of advertising. And with that advertising, there are some deceptive terms that people use. So you have to really be sure that the person who's doing your procedure is actually a plastic surgeon. And it sounds like you take it for granted. Gee, I saw a big ad. He says he specializes in liposuction, or he does a lot of breast implant surgery. He must be a plastic surgeon. It's not true. In fact, in New York State, the law is that any doctor can do any type of medicine that they want, as long as the patient agrees and consents. So what some people do is they'll put things up like, I am a board-certified physician. A board-certified physician means you're certified in whatever board of medicine it is. You can be an internist, OBGYN, dermatologist, whatever. And it's perfectly legal for them to do these procedures. But what you really should look for is on the advertisement or in the office, it should say, board-certified plastic surgeon by the American Board of Plastic Surgery. And if you're unsure if they're a member, you can go to plasticsurgery.org and you can check out your doctor, make sure that they are board certified.
And those are the people that really should be performing plastic surgery.
Well, I mean, there are other overlapping specialties that can do certain things. There are some doctors who, ENT physicians who are facial plastic surgeons, that's the buzzword they'll use for doing cosmetics, do very nice rhinoplasties. It depends on the procedure that you want, but you should be aware of what your doctor's trained in before you select them for your procedure. Second thing is where it's being done. Is your procedure being done in an accredited facility? Because you don't want it to be done in just any room. You want to make sure that it's the safest possible environment. Is it in a hospital operating room, outpatient clinic, or is it in the office in an accredited facility, or is it just an exam room?
Let me talk to you a little bit about the difference of when to actually do plastic surgery.
Sure.
When you talk about plastic surgery as we know it right now, one of the things that we talk about when you have plastic surgery is, when do I actually make the and they look like, you know, this beautiful picture. But when to actually have it? I think that's a question that goes to the hearts and minds of many people, because when do I really need plastic surgery? I think people say, well, you know, my smile isn't the way that it should be, I'll do it. But really, when are some real serious cases when plastic surgery is absolutely necessary?
Well, if you're talking cosmetic plastic surgery in specific, you know, obviously there are things like breast cancer reconstruction and accidents where plastic surgery is required. No cosmetic surgery is required. Nobody needs plastic surgery. It's to look better and to feel better. And my rule of thumb is, if it's something that bothers you enough that you're looking in the mirror every day, it's depressing you, it's something that affects your activities of daily living, it's worth seeing a plastic surgeon to see what's involved and to see if it's something that you want to do. If it's because your husband's got a wandering eye, or that you think you're not advancing in your job because of the way that you look, those aren't great reasons for doing plastic surgery. It really has to come from within you, and it has to be something that you want to change about yourself for yourself.
What are some of the downfalls? Because, you know, we hear the positive side, and we see people, and some people do look better, and some people look horrible. I mean, it's horrible after the job. I think sometimes I've even commented on some people, I will keep them nameless, but I've commented on some people I've seen on television. I thought they looked so much better before they actually did it. But there is a downside to plastic surgery sometimes, and I wish you would share with our viewing audience, what are some of the downsides to plastic surgery?
Well, you want to make sure that the idea isn't to look different, it's to look better. And what are the realistic expectations that you can have? When I do, in my office, when I do consults, I use computer imaging to try to give the patient a realistic expectation of the changes that I can provide right on their own faces with the computer software, as well as showing a lot of before and after pictures of very similar looking patients in terms of skin type, ethnicity, to make sure that it's going to look right on you. I mean, you can say, gee, you know, I really think that Selma Hayek has the most beautiful nose I've ever seen, and you put that on your face, it doesn't look right. And you want to make sure that it looks right for you. So you have to be realistic in your expectations, and I think the key is communication. And if you communicate well with your patient, and you both have the same goals in mind, everything turns out well.
I want to get to this. Why, you're talking specifically about the Hispanic community, why does it seem like the Hispanic community in many cases seems to go overseas when it comes to doing plastic surgery? Because there is a growing trend of people going overseas.
Yeah, I did my training in medical school at Columbia Presbyterian, right in Washington Heights, and as the only plastic surgeon who spoke Spanish, being a heavily Dominican community, I became the go-to person to talk about the cosmetic surgery issues. And unfortunately, in the emergency room, every week we would see a patient who had had a procedure overseas and would come literally from the airport right to the emergency room with complications and issues. Not to say that there isn't good plastic surgery being done elsewhere, because there is. We only saw the bad ones. But the interesting thing was when I talked to them and said, why would you go to the Dominican Republic or whatever other country to have your surgery done when there are doctors right here in Manhattan? It wasn't always money. And a lot of patients said, you know, I don't feel comfortable on Park Avenue. My English isn't that good. Nobody else looks like me in the office. The doctor can't talk to me directly. There's always somebody translating. And I'm not sure if he really gets my aesthetic ideal, because the aesthetic ideals in the Hispanic community are a lot of times different than in other communities. And that's what put the thought in my head of, how can I educate the community as to having surgery in the safest possible environment? And I thought the best way was to create the safest possible environment. And in 1997, I opened Yager Plastic Surgery, which is now Yager Esthetics, where it was an office with an accredited operating room and a full service center that had the highest in quality. And every single employee and every single piece of literature we have is bilingual in Spanish as well, and I speak to the patients directly.
Now, is plastic surgery different for Latinos, Latinas?
Some of the goals and shape ideas are different, and different communities like different things. Some, and culturally, people like different things. Some patients like a fuller hip and buttock. Some patients want to be real thin down the lower parts of their body. Some people like a very full round breast. Some people like a smaller breast. And you really have to listen to your patient to make sure you do the right thing for them and what they're looking for, not necessarily your personal aesthetic goals.
What are some of the things that you're hearing from your patients when it comes, particularly in the Latino community, about plastic surgery? What are some of their basic wants and desires?
Interestingly, the Hispanic community is the largest minority in seeking plastic surgery in the United States. Nearly 1 in 10 procedures done in the U.S. is done on a Hispanic patient. It's the fastest growing segment as well. And the most popular procedures in my clinic are a little different. They are liposuction, because everybody needs to move a little fat. More commonly nowadays, people like to use the fat to kind of give a fuller buttocks area, because it's more desirable. And breast augmentation and tummy tucks, those are the main things. People have their children, they want their bodies back, and that's what we try to do, is to give them their bodies back.
So share a little bit before we wrap up, because we do know that you're located in Washington Heights, and you are trying to provide, well, you do provide services to all communities, but yet and still, I know you have a particular passion of working with the Latino and the Latino community. What would you want them to know from you in regards to plastic surgery and options?
Well, I think the key is do your homework. Make sure you're comfortable with your doctor. You know, at Yager Esthetics, we try to make you comfortable. I mean, our office is 6,000 square feet. I mean, it's probably the nicest office you'll ever see, and I don't charge for consults, so people really can get access to the clinic, see what we do, see the level of service we provide, and educate patients. And if I'm not the right person for you service-wise, I will refer you to the person who is the right person for you.
Last question before we wrap up. There's a person who's out there right now, they're watching and they're saying, listen, I'm considering plastic surgery. I'm going to come through the door. I'm going to talk to Dr. Yager. What are some things they need to know before they come through the door to see Dr. Yager?
You really should know what it is that bothers you. Don't come to the doctor and say, you're the doctor, you know, just make me look better. You should look in magazines, you should look online, and try to find images of people that have the feature that you want, and that helps to communicate better with your doctor.
All right, Dr. Jeffrey Yager.
Thank you so much for having me.
He is a board-certified plastic surgeon, and you can find him in Washington Heights. His contact information is at the bottom of the screen, and of course we'll continue to provide it here on Open, giving you the information and the tips that you need to have effective plastic surgery.